Jalony mag thiedho nyiso luoro ni chenro mar chiwo thieth mar Universal Healthcare kidekre mchopo kare kalura gi nok mar lakteche mokwako pachoka. Kata kamano gipuoyo okang' ma piny owacho kawo mar tiyo kanyakla gi riwruog lakteche mawuok e pinje maoko mar chiwo tiegruok ne jochiw thieth e rang'iny mamalo. Joja oko nigi ler mathoth kowuok Mombasa.
En romo mane okelo kanyakla jolony e weche mag thieth kuma bende laktache 15 mawuok e pachoka mayande dhi nyime kod yudo tiegruok e rang'iny mamalo ne osidhi. Kane giloso Mombasa, jolony go koni midhiero mapek masani okwako sekta mar thieth en nok mag laktache midendo ni physicians mikone gin 400 kende e Kenya mangima.
Kiangalia viwango vya physician wale ambao tuko nao, kila physician mmoja anaweza tibu wagonjwa 10,000 ambao hata hairuhusiwi katika WHO. Ndio tukaamua tushikane na hawa watu wa Royal College of Physicians, tuwaelezee tatizo letu liko wapi na wanaweza tusaidia vipi.
We want to thank the Kenyan government because they have allowed an extra college, a college without boundaries, so that we can increase the number of physicians. So to the Kenyan population, be assured that wherever you are in the country, we are training the general practitioners to be physicians so that you do not have to travel to the main towns just to receive specialized care.
Midhiero mar onge mag thieth makare e ute thieth manie kor gwenge gikoni kidek yudo lokruok to chutho kaluwore gi chenro masani dhi nyime mar tiego laktache thieth e rang'iny mamalo.
We have graduated 15 physicians in this region who are training at the site that they normally work. This is a big milestone for us because this is the largest conference hosted by Exacop since its inception, and we look forward to total government support for this program because the physicians are training in their local where they work from.
Kiangalia tulikuwa kuna ile tunaita Universal Healthcare ambao kama saa hii utaona wagonjwa wanaambiwa wengine waende level 4, wengine level 3. Lakini ukiangalia shida pahali iko katika level 3, level 4, huna mhudumu ambaye amefika kiwango kile ambacho cha consultant level. Kwa sababu gani? Huku juu wenyewe hawako wengi. Lakini ukiangalia hii program, watu wakianza kuwa wengi katika level 5, inabidi wengine uwashukishe waende level 4. Watu wakikuwa wengi katika level 4 na washukisha waende 3. Kwa hivyo primary health care inaanzia chini.
Kata kamano, gikwayo piny owacho mondo mi omed kwan omenda mageto kedo gi tuoche ma ok landre midendo ni non-communicable diseases mikoni sani koro juko nyaka rowere kopogore gi kinde machon ma tuoche go ne thoro mana mako jodongo.
Prevalence of pre-hypertension, pre-diabetes in people as young as 15 years is actually on the rise. So we are seeing NCDs occurring at a much earlier age. So where we are seeing this disease occurring at the age of 60, it's now not uncommon to find someone with diabetes, hypertension at the age of 30. So there must be regulation and policy to ensure that we have proper food labeling.
Diabetes and hypertension has been linked to cancer. Now we are finding that patients who have had HIV are now living longer and developing the non-communicable diseases. And that's why we are joining hands together. Let's try and see if we can convince Treasury to change some of that budget towards non-communicable diseases, screening and management.
George Aoko, Ramogi TV, Mombasa.